Dr. Abdu Sharkawy is, of course, CTV News infectious disease specialist, and he has been doing tireless work throughout this. Great to have all of you here. Doc, I'm going to start with you because I'm sure for you, who just does phenomenal frontline work, I'd love to hear your reaction to the news and what this means for frontline workers who I know still have a long road ahead.
Well, obviously, today was a very momentous occasion in terms of Canada really putting its stamp on being at the forefront of vaccine delivery. I think the criticism for a long time was we didn't make enough vaccines and there wasn't enough effort put forth. And frankly, Health Canada pulled a rabbit out of their hat in terms of beating the FDA to this approval. I'm confident they went through their due diligence. It gives me hope as a healthcare worker and as someone who's seen the devastation in long-term care facilities that we're going to save more lives sooner. And that's a tremendous accomplishment.
Doc, let me just stay with you one more. What are your questions now in terms of, from a medical side? Do you have any in terms of the rollout, in terms of telling, and I asked Dr. Sharma this, folks that are concerned about the science or the speed of this, what questions or concerns would you have, sir?
Oh, absolutely. I think our next real big task is to try and educate our public to allay their concerns. We saw what happened in the UK with the allergic response with both healthcare workers there. And, there's a lot of anxiety, of course, and uncertainty in the public at large. Our job is to make sure we're as transparent as possible about the data, about understanding who was enrolled in these trials, what subsets of patients were there, how representative this will be to our community at large, and to do our best to remind people that at the end of the day, the risk of COVID-19 and all of its attendant complications and death is largely going to exceed the risks of any vaccine. So we've got to do our job and educate and engage people.